So this one I'm kind of excited about, so we'll jump straight into it, but there's a couple of things that I need to like explain before we go into all of the words, you know what I mean? So let me share my screen.
Oh, yep. Here we go.
All right, so there's not much going on the screen. This is literally just it. But let me explain a couple of things first, okay? So this is a study of 60 children that were aged between 5 and 7 years old with no previous dental experience so that they could do pulpotomies. And that's like dental surgery on the pulp of your teeth, okay? So it's big stuff, right?
So
This
what's the pulp of the teeth?
So that's where instead of having your teeth, you've just got the squishy part, like your gum.
Ah, okay, yeah,
So
gotcha.
yeah. Now, this one is really, really fascinating because there's a couple of layers going on here. And you know me, I love layering and then it just ticks the box. So let me explain it before we get started. So what they did was they did two groups and one was randomized and one was what do they call it? One was experimental. Okay, so they had the controlled group, which was conventional behavioral management techniques like, calm down, just do some breathing, blah, blah, blah. And then they had what they called the experimental group, which was hypnosis. Now, these are kids, so they're aged between 5 and 7, right? Then the other thing I want to explain as well is they did what they called the FLACC scaling system. So the FLACC scaling system is every single letter, so FLACC gets 2 points. So a maximum of 10 points can be achieved, right? F is for face, L is for legs, A is for activity, so moving your body, C is for crying, and C is for consolability. Now, if they look at the face, they want it from 0, 1, or 2, 0 meaning relaxed, 1 being they occasionally grimaced, and 2 being they completely frowned and clenched their jaw, right? Same with legs. Legs, 0 being relaxed, leg or 1 being legs were uneasy, or 2 they were kicking around. Okay, so every single section can be worth up to 2 points and a maximum of 10. So what they did, they used the FLACC system for this because they're kids. Then on top of that, within the FLACC system, they also did their heart rate as well and skin too many big words. But the point is the skin reacting. So were they sweating, were they blushing and all that sort of stuff. So there were those scaling systems within this system as well. Then on top of that, they did the percentage scaling system as well. So the percentage scaling system works out what is the percentage of this is just chance. Like they're working with children here. A lot of children don't understand adult language. So what is just the odds that you just got a relaxed child compared to an anxiety child whilst having dental surgery on the gums, right? So they're the layers that we've got going on here. So out of the 60 children, they separated them into two groups, one controlled with behavioral therapy and one was experimental with hypnosis. Then they had the FLACC system, the heart rate, the skin test, and then the percentage of probability that, this is just a chance situation. So let's go with it. So what was this to prove? This was to prove that anxiety and pain is a combined experience that can hinder dental treatment in children and lead to development of negative behaviors of any form of surgical treatment for the future. So if they had the dental treatment, later on in life, they could have bigger issues with any other kind of surgery, right? So that what they did was they did hypnosis for the reducing of anxiety and pain for the dental treatment. And the whole aim was the too many big words. I haven't had enough coffee, even though I don't drink. Yeah, the
Efficacy.
that's it. So it was all about showing that hypnotherapy, whether it can reduce anxiety and pain, and it was measured with the face, the activity, crying, etc. as well. So they took 60 children aged between 5 and 7, separated them into two groups. And then on top of that, when they separated them into the two groups, they then did follow-ups of whether this had any long-term assistance or not. And check this out, right? So what they found was that it was extremely effective. So let me get the stats up. Let me find it. It's in the breakdown here. Okay, so some of these children even went through partial root canal, so right into, the pulp as such. So what they found was hypnosis significantly reduced anxiety levels during the dental procedure. So that was during the procedure. Children in the hypnosis group showed lower heart rate and skin reactions, indicating reduced physiological stress. The hypnosis group maintained lower anxiety and pain scores throughout the procedure and continuing on afterwards. How cool is that?
Very cool. Yeah.
And then let's go into it just a little bit deeper, okay? So what they did was they did the percentage rating system. Now, the percentage rating system can go from 0 to 100 because you've got 0% to 100%, right? Obviously, the higher it is, then the higher the rate that this was just a chance thing. This was just a once-off hit good moment. What they found was when they did the percentage system in the experimental group, that they only found a 0.022% chance for the entirety of the treatment that this was just a chance that the child was relaxed. So it's so small because in the study world, anything that's 0.05 or less, they usually just go, nah, forget it. It's not even worth studying. That's like having a quarter of a grain of salt in the ocean. We don't, it gets so diluted, we don't even think about it. So that's what it's talking about. So for the entire treatment and duration, that the children had significantly lower symptoms of pain, and it was a 0.022% chance that it was just a lucky hit.
Yeah. And over 30 kids, obviously, if there were 60.
Yeah, exactly. In addition, the heart rate and the skin tests were both significantly lower in the hypnosis group, so in the experimental group, with a percentage hit rate of 0.005 compared to 0.032, which was in the controlled group.
Yeah.
How cool is that?
Yeah, it's very cool.
So they're both very effective, both very, very effective, but hypnosis significantly more effective for not only when they were having the surgery, but also afterwards in relationship to having surgery for any other reason.
Did it go into what they actually did, whether they had someone working with them in the
No,
surgery, whether it was
didn't actually.
recording?
It does have related articles as well that you can go into, which is way more in depth that I wasn't willing to go into for this video. Because when I started going into it, I'm like, wow, this is like even deeper than the deep of the
It's a
deep.
whole, that's a lot.
Yeah, and it is a lot as well. So also when they compared to the conventional behavior management techniques, the FLACC scale demonstrated that hypnosis was associated with a significant reduction in heart rate, the skin test, anxiety, and pain throughout the entire duration of the treatment. It decreases the anxiety during the entire operation procedure, and there was clear improvements in anxiety and pain control in patients receiving hypnotic therapy.
Yeah.
So we really need to work more on getting hypnosis inside of the dental industry.
Yeah.
For longevity. So this particular study is like, sure, it's done with kids, but it's not just about the kids having dental surgery. It was also about the kids associating that kind of instance young in life to having something done later on in life. Now, when they said something later on done in life, it wasn't just dentistry. It was any form of surgery.
Yeah. And we know how so many people are scared of the dentist, or even scared of surgery, or scared of anything medical. Getting a blood test is huge.
Yep. So that's what I love about that particular study. And I will throw the link to that inside the comments for you to throw on your blogs, on your social, etc., etc. But the
Yep.
one thing that I do love about the children part is that they're not like adults. We don't just pull away and go, oh, I'm not having this. Children tend to be more compliant because they've got the parent in the room or an authority figure, and then they will, push through those barriers. But not
Yep.
only did they not have to push through those barriers, they actually could test it without rigging the child up to more stuff.
Yeah, yeah, yeah. And I
Yeah.
mean, kids don't have that preconception of what hypnosis is either, or what's being
Exactly.
done compared to adults. Like they
Yeah.
wouldn't be thinking they're going there thinking, well, I'm being hypnotized, so maybe I'm supposed to respond this way, and which kind of changes in a good way. It can, help with suggestions going in, but at the same time, it's hard for testing.
Yeah, absolutely. And the other thing it doesn't mention inside this study is it just took 60 children between 5 and 7. It never mentioned if they were boys or girls.
Yeah,
It just said 60 children.
yeah, yeah, yeah.
So it doesn't matter because there are people out there that go, oh well, because I'm a female and I've had toxic relationships, I can't do this. It's like it doesn't matter.
Yeah,
It's
yeah, yeah.
about your mind and how you concentrate.
Yeah, yeah. It's a good age to do because between 5 and 7 is when they start getting that self consciousness coming in, meaning
Yes.
meaning my body is mine, not part of the family or the parents and all of that kind
Yeah,
of.
and they're starting to choose their identities and their directions and what they want to represent in the world. So that
Yeah,
was really, really fascinating. And like I said, I love the fact that it did the FLACC system and then it did the percentage system, then it did the heart and the skin and the anxiety and the pain. So that's a mo
it's very, very cool.
so yeah, so cool.
And when was that one? What year was that one done? Did it
That
have the year?
one was done. Hang on a second, I can find the year. That was done on in January 2024.
Awesome. So not that long ago. It's pretty amazing. There's a lot of research being done in the last 5 to 7 years. It's just more and more and more and more. Eh?
Yeah,
I'm
absolutely.
loving
And
everything.
that was actual surgeries. So,
Yeah,
mouth open, still being awake,
yeah,
inside your gums, root canals, big, big stuff, and significantly lowered the pain and the
yeah.
anxiety
And
plus
even if
the
even if you
association.
do have a local, I know when I just had some just really basic dentistry done, just the feeling of having things in the mouth and the moving your mouth, even though you're numb,
Having to stay still.
having to stay still, and the feeling of tugging and moving and the noises that you still hear and the person coming down and the gloves, the whole experience. I'm probably making people feel yuck, but the whole experience itself with anesthetic or no anesthetic is quite a
Mm.
full on experience to have. So to be able to calm them down while that process is happening, and hands must be so big. Like
Mm.
when you're got a dentist in your mouth,
And you're only a little
as
kid.
adults, do you know what I mean? They're pretty big hands.
And kudos to the dentists that were involved with this as well, because, like, getting kids to just have a haircut sometimes can be a drama.
Yeah, yeah. And having 60 kids that need work done.
So yeah, so that's a really, really cool study. I will throw that link down in the comments. So I just chose a really quick, short one today, but
Yeah,
please throw these out in your blogs and your social media and get it
yeah,
out there more. So yeah,
yeah. Very
that's
cool.
it.
Thank you. That's a good one.
Quick, sharp, and sweet.
Awesome.
So, all right. Well, that's it. Bye bye,
Yeah, we're
everybody.
done.
Bye.